Thank you, Mr. Chairman.
You're welcome.
My name is Marilyn Wood, and I am the multi-vice president for the Florida Healthcare Board of Directors. And I'm also the president and the CEO of Opus Management Resources. I actually operate 10 nursing centers and 1 assisted facility in Florida. I am a small business owner with centers from Jacksonville to Largo. This business is my passion. I do this as a passion of my life. I've been a provider for 39 years, 25 years in the state of Florida. I will continue to be a provider during this session and in many sessions in the future. That is because I take very seriously my obligations and my promises to my customers, my team members, their families, and my personal commitment to long-term care. I employ over 2,000 people. I take care of over 1,500 residents. This is not something that I can or I can walk away from. I cannot turn in my 30-day notice. I have all of my personal assets and my reputation as a Governor Gold Seal recipient of 5 of my centers out of 11 over the past 3 years as an indication of my commitment to quality and to long-term care. And we really do appreciate the opportunity to partner with you in this process. And I realize that you're going to hear a lot of information today, but I'd like to emphasize one point. Florida's long-term care system, including nursing home care, is not broken. We are efficient. We care for people who cannot receive care in less restrictive settings with sustainable, long-lasting results. And this is evidenced by our discharge rates, our improved national and state outcomes to quality, and our resident and family satisfaction surveys. We do not believe that the bill as written would improve care for seniors and ask that long-term care not be brought under managed care as it is envisioned in this bill. We certainly agree that the Medicaid system is in need of reform. However, the growth in the Medicaid budget has not been caused by the increase in nursing home enrollment. In fact, 19% was reduced in 2001 to less than 13% in 2010 as part of the overhaul Medicaid budget. And as you know, Florida has done an exceptional job at ensuring individuals requiring long-term care services receive the proper care in the least restrictive setting based on their medical needs. Certainly everyone wants to remain at home as long as possible. We understand that, and we have always supported the full continuum of care and resident choice. But when an individual's needs are simply too great to function on his own, that's when we come in. As a long-term care provider, our goal is to do all we can to provide quality care, which will help individuals return home. At Opus, we actually discharge 37% of the people that are admitted to our centers. The way people are admitted to nursing homes has changed drastically over my 39 years of my career. We admit over 85% of our residents from the hospitals directly, and the other 15% are admitted due to a crisis that probably has occurred, and therefore the resident needs a higher level of service than they were currently receiving in an independent living or an assisted living or even in home care. The caregivers, which most of them are either an elderly spouse, which is a woman, a senior themselves, who also have health issues or caring for this loved one, and or it could be a child. And usually they come to our centers, they're exhausted, and they've reached a point of desperation because there's the definite need for 24-hour skilled nursing service. I tell you this to help you to understand that the typical long-term care resident cared for in our centers are there because they need to be. There's no other setting that would offer the same 24-hour skilled care with the same federal and state oversight that ensures that high standards that we have worked so hard for over the last 10 years. I think about the gentleman that just spoke earlier about the concern of admitting people to assisted livings that are not going to have the kind of oversight that we currently have in the skilled nursing setting, but people are going to be going toward the assisted living situation because that's going to be easier and it's going to be less expensive for them. We believe that The 7% savings within the first year of implementation is going to negatively impact our ability to have quality. As again, the cost that we incur is 70% of our cost are our labor, is the amount of money that we pay for those that we employ. And we believe that a 7% mandated savings can only be achieved during the first year by cutting our rates. And that, in fact, is going to affect the quality of care. The managed care study done by the Pacific Health Policy Group last spring for the Florida House of Representatives indicated that the managed care had a potential savings of only 3 to 5% once the program is fully established, and certainly not during the initial year of implementation. We believe that the only way managed care is envisioned in this bill could achieve these savings is to cut the provider rates, which then reduce our services. We have a significant concern that the bill as written doesn't protect the nursing home quality assessment program, an important point that also made in the Pacific Health Group report. The quality assessment has allowed the state to draw down an additional $622 million in federal Medicaid dollars to fund nursing home care, helping the state of Florida to save $219 million. You have asked us to become partners with you in the Medicaid reform by giving us an opportunity to become provider service networks, and we have explored those opportunities. I personally retained an outside consultant, Oliver Wyman, to explore opportunities to create provider networks. There's much to consider. First and foremost, the capital funds that would be required are really far-reaching. The Stark laws of self-referral would be a serious consideration. And what about the significant increased risk that would be assumed? It certainly isn't an avenue to pursue without an extensive business plan and pilot models to work through the challenges and the pitfalls. So again, I would just reiterate that the Florida long-term care system isn't broken, and that we have proven that we provide efficient and quality care for the frail elderly in a very safe environment. Thank you.